Hey, it's Dr. Bryant at Refined Surgery in Nashville, Tennessee. I wanted to talk about this patient because I think it shows a great example of how you can have a really dramatic change, and because you look like yourself afterwards, which is kind of that facial fingerprint I talk about, it still looks very natural. We brightened her eye area doing an upper eyelid lift, also known as an upper blepharoplasty, where we remove a little bit of the puffiness you can have and kind of the tiredness that happens over time. In the lower eyelids, we get rid of the fat pads, and again, we don't just take all the fat out because that will be smooth, but it will also be hollow, and that goes back to kind of making you look altered or changed, not really rejuvenated. So most of the fat we keep, but we reposition it. So we take the puffy fat pad, we move it down into that hollow area underneath the eyelid. So now instead of being smooth and hollow, it's smooth and rejuvenated. If you have a picture from 10 or 15 or 20 years ago, my goal is to get you to look like that. We decided not to do a brow lift on her because she was happy with her brow position, and I think that helped her get a more natural result. On her, we did an extended deep plane facelift where we lifted her cheeks, kept most of her facial volume, but just repositioned it so she looks natural, but it's still a really dramatic change. In her case, we also did some additional contouring procedures where we reduced the buccal fat a little bit. We trimmed a little bit of the tail of her parotid gland to get a little better jawline definition. And then in the neck, I think she's a really good example of why a deep plane neck lift or a deep central neck lift is important. And so if we had just done liposuction, she would have some contour, but you wouldn't get that sharpness and definition that she had. So we did do a little bit of liposuction to get rid of some of the subcutaneous fat, but not so much that she has banding or stranding. You want that natural cushion there. And then underneath the platysma muscle, we address the deeper neck structures, which would be your deep central neck fat, occasionally submandibular glands, and your digastric muscle. And by doing that, we're able to give her a better neckline and jawline than she's ever had in her entire life. So it's dramatic, but it does still look natural. So it's rejuvenating, not altering. And I think that's where kind of that phrase I use, your facial fingerprint, comes into play, where no one would look at her after, as you can see, and think, oh man, she looks so operated or so treated. You just think like, wow, you look great. Did you change your hair? Did you do makeup? Have you been exercising? You can identify or notice that something changed, but you still look like yourself. And that's the beautiful thing about natural deep plane facial rejuvenation.